ATW Health Solutions specializes in patient and community engagement as part of healthcare transformation. We champion the inclusion of everyday people and community-based organizations interested in driving positive change in the healthcare system because of their lived experience. Our work influences research, policy, quality, patient experience, performance measurement, education, training, and improved organizational and patient outcomes. Our work promotes the inclusion of diverse voices and equity in partnership with patients and communities at the national, federal, state, and local community levels. In 2020, ATW connected more than 150 people with lived experience as patients, family members, caregivers, and members of their communities with local, state, and national committees, focus groups, and other type activities and projects to improve healthcare programs, systems, and health outcomes. In 2021, we placed more than 200 people, and in 2022, we want to connect with you. Our team of equity practitioners understand the importance of equity. We ensure that our community of Ppic members come from all communities and backgrounds. With approximately 3,000 active members, ATW Health Solutions has created one of the nation's largest and most diverse patient and consumer networks. Ppic members represent Black and Brown communities, various ethnicities, nationalities, and languages, including rural, transgender, and the senior populations, just to name a few. We do this work because we recognize that diversity and inclusion matters. Healthcare organizations often lack the experience, time, and resources to adequately foster strong patient and community relationships. If you are a person that would like to be part of change and improvements in healthcare and research, please contact our office by email or phone. ATW Health Solutions has multiple use cases for our Ppic product. We can help your organization reach its goal efficiently and effectively with our Patient Development Accelerator, and by engaging with your team to design and implement a patient and community engagement strategy. Really having a diverse profile of people, is urgently needed, in particular in the healthcare space, as we look at ways to improve outcomes and eliminate disparities. And all too often, their voices are not included. And so Ppic was designed to make certain that we had a framework to stay in connection with people all the time, to build and cultivate the right relationships with those people in real communities, and then pull them into the work when the work became available or becomes available. When you think about social determinants of health, and when you think about all of the other aspects or elements that can actually influence one's health outcome, much of that happens in the community, if not all of it. And it's important to understand the experiences in the community, meaning what my commute to the emergency room was like, what my experience was like once I was discharged back home and I needed to go and pick up my prescription. And so really having an understanding of what people actually go through as it relates to managing their health and or navigating the health system is important. So ATW Health Solutions is all about making certain that engagement and equity are core pillars in all of the work that we do. What does that mean? That means that whether we're working with a hospital or health system on measurement, whether we're working to improve quality, whether we are working with the federal government on some education and training, at the end of the day, what we very intentionally do is ensure that there is a vehicle, avenue for diverse voices to play a strong role in the development of that work. So it is a community, right? And it's a network that everyone, comes to with this one unified goal of improving healthcare. And so once people understand that and understand that's really what, our cause is, they really stand behind it. They get behind it 110%. And then the health systems, the hospitals, the work that we've done in federal government, you'd be surprised just how your everyday experience really raises the eyebrow or helps another person translate and or understand what changes need to be made.